Hello, Dr. Mark Dailey here. In our last video, we discussed the origin and discovery of subclinical gluten intolerance as well as its similarity with celiac disease. We mentioned that celiac disease is not subclinical because the symptoms are so obvious. In many people, however, who suffer from gluten sensitivity, the symptoms are noted as subclinical because they're subtle, which means it's very hard for the clinician or the patient to associate that. Now, what exactly is subclinical gluten intolerance, you may ask? Well, subclinical gluten intolerance refers to exposure to the gliadin molecule and to a specific inflammatory reaction taking place in the small intestines of afflicted individuals. In fact, gliadin intolerance would be a more scientifically accurate term than gluten intolerance to refer to this condition. Gliadin is a polypeptide, a long-chain amino acid which is present in the gluten protein portion of certain grains. The subject is confusing, and there is much misinformation about gluten and gliadin. To clarify, gliadin, the molecule that causes the problem, is present in some, but not all, gluten-containing foods. People with this problem must avoid glutens from grains of wheat, rye, barley, kumalt, spelt, teff, and couscous. Some of these grains have lower concentrations of both gliadin and gluten than wheat does, but any food containing the specific gliadin, even from a lower concentration food source, is not well tolerated by people with subclinical gluten intolerance. This dietary restriction eliminates bread, pasta, bagels, and cereals. Now, there are rice and almond-based breads available, usually found in the refrigerated section of your local health food store. There's also rice, yam, and corn-based noodles and cereals, crackers, and other gluten-free substitutes on the market. Now, soybeans are another food to which you may, or people with gluten intolerance may react. It's best to avoid all concentrated forms of soy protein, such as soy protein powders, tofu, tempeh, which, while you are first eliminating gliadin or gluten, and then you can reintroduce it back into the diet at a later time to see how reactive you are to soy. Even though soy has gotten a lot of attention in terms of its ability to help women with hormonal imbalances and bone loss, this does not hold true for those women or individuals who are gluten intolerant, as soy can actually cause inflammation and ultimately exacerbate hormonal imbalances and exacerbate bone loss. Now, keep in mind, most of the positive things about soy are from fermented soy. The bulk of soy on the market today is not fermented in any way. So there are components in it that mimic estrogen, and this can cause some serious health issues. So my advice really is to avoid soy if possible. Now, let's consider treatment of this particular problem. Obviously, the main treatment for this problem is total avoidance of the offending gluten-containing foods. In addition to this dietary change, you can help decrease the inflammatory process associated with gluten reactions with several natural products which we use in our facility. Most people don't feel better immediately after eliminating gluten from their diets, as it can take 60 days for the inflammation to subside and up to 9 to 12 months for the lining of the small intestines to heal. On rare occasions, an individual may experience significant improvement within weeks of being on a gluten-free diet. In certain cases, people may feel considerably worse initially starting a gluten-free diet. But for most people with this food intolerance, by around 6 to 9 months of being gluten-free, noticeable changes are taking place. In the next video, we're going to talk about some physiological effects of subclinical gluten intolerance, which will include inflammation, its effect on the immune system, nutritional deficiencies, and much, much more. But the pieces of the puzzle will come together and you'll see how it actually affects you in your day-to-day life. Thanks so much for your time and attention. God bless and have a great day.